Hello everyone. Today we're going to walk through a nursing care plan, which is also known as the nursing process. You will come across this quite often throughout your nursing course, and it's just as important in a real-life clinical practice. The goal of a nursing care plan is to provide holistic, high-quality care that is tailored to each patient's needs. We use the acronym ADPIE to help us guide through the nursing care plan. It stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation. Let's work through a scenario together and build a nursing care plan step by step. Mary, a 70-year-old patient who reports feeling scared, anxious, and has been experiencing insomnia after the sudden loss of her son. Due to prolonged bed rest, she has started feeling weak and unsteady on her feet and now needs assistance with her ADLs. She was admitted to respite care due to deconditioning. During the assessment, the nurse noticed a small skin tear on the patient's arm. After speaking with the nurse, Mary has agreed to take part in group activities to help improve her mood. The first step in ADPIE is assessment. This is where we gather both subjective and objective information. Subjective data is anything the patient tells us directly. In this scenario, that includes the patient reporting that she feels scared and anxious, is having trouble sleeping, feels weak, and needs help with her ADLs. Objective data is information we collect through observation, diagnostic tests, and physical examination. This can include things like vital signs, head-to-toe assessments, focused physical examinations, lab or radiology results. In this scenario, the objective data is the small skin tear on the patient's arm that the nurse noticed during her assessment. The next step is diagnosis. Before writing a nursing diagnosis, it's important to understand the standard format. Blank, related to, blank, secondary to, which is optional, blank, as evidenced by, blank. The first part identifies the problem. The second part explains what's contributing to the problem, and the optional secondary to helps clarify the underlying cause, which is not always stated in this scenario. The final part, as evidenced by, describes the signs or symptoms or any defining characteristics that support the diagnosis. Trust me, it might sound a bit complicated at first, but it becomes much clearer once we apply it to a real example. Before going into detail, let's take a look at the different types of nursing diagnoses that are commonly used. There are four main types of nursing diagnosis. The first one is the problem-focused diagnosis, which looks at issues the patient is experiencing right now. In this scenario, one of the patient's main problems is weakness that requires assistance with ADLs. Using the nursing diagnosis format, we can write it like this. Activity intolerance related to generalized weakness secondary to prolonged bed rest, as evidenced by the patient reporting weakness and an increased need for assistance with ADLs. Here, activity intolerance is the current problem. It's caused by generalized weakness, which is the result of prolonged bed rest, leading to muscle strength loss. The defining characteristics supporting this diagnosis are the patient's reports of weakness and her increased reliance on help with ADLs. Together, these show that she's struggling to tolerate activity and perform daily tasks independently. The second type of nursing diagnosis is known as a risk diagnosis. It refers to potential problems that may develop if the patient's current condition progresses or if their health status deteriorates. This type of diagnosis typically begins with the word risk, indicating a vulnerability rather than an existing problem. In this scenario, the risk diagnosis is Risk for falls related to functional decline and impaired mobility, as evidenced by advanced age, muscle weakness, and an unsteady gait. Well, we can see that functional decline is the primary factor placing the patient at risk for falls. This is supported by information in this scenario, including the patient's advanced age, reported muscle weakness, and an unsteady gait. A syndrome diagnosis is the third type of nursing diagnosis. It describes a cluster of related problems or diagnoses that are best managed using similar nursing interventions. In this case, Mary reports feeling scared and anxious and is experiencing insomnia following the loss of her son. These symptoms can be collectively classified under post-trauma syndrome resulting from a sudden and an unexpected event. The correct format is post-trauma syndrome related to the sudden loss of a son, as evidenced by insomnia and the patient's verbalization of fear and anxiety. A health promotion diagnosis focuses on the patient's motivation or desire to improve a specific aspect of health. This diagnosis always begins with readiness for enhanced. In this scenario, the patient is willing to participate in group activities, so an appropriate diagnosis is readiness for enhanced mood and coping, as evidenced by the desire to improve social engagement. As the underlying cause of this readiness is not clearly identified, a related to statement is therefore not required. Planning, also known as goals, are what you aim to achieve based on the patient's needs, wishes, and preferences. It's important that all goals follow the SMART principle, which stands for specific, measurable, achievable, realistic, and timely. Well, there are two types of goals. Short-term goals, which are achieved within a few hours up to 4 weeks. Meanwhile, long-term goals are anything longer than 4 weeks, extending to months or even years. For this scenario, the short-term goal is Mary will demonstrate improved mobility with minimal assistance in ADLs within 2 weeks of receiving respite care. This goal follows the SMART framework because it is specific, realistic, achievable within the 2-week time frame, and measurable through the patient's level of independence, gait, and mobility. If we expected this outcome within 1 day, the goal would be unrealistic and unachievable. A long-term goal for this scenario is the patient will remain free from falls throughout the admission and at the time of discharge. Now, let's look at implementations. Implementations are the strategies we put in place along with their rationales to help achieve the set goals. You can have multiple interventions targeting a single goal. Let's focus on the short-term goal we set for Mary. To improve Mary's mobility within the 2-week period, we can support and encourage her participation in self-care, hygiene, and ADLs. The rationale that supports this intervention is encouraging participation in ADLs promotes independence, builds confidence, and reduces fear of falling. Lastly, it's the evaluation, which involves reflecting on whether the goals were met within the planned timeframe and whether the interventions were effective. Since every patient is different, not all interventions work the same way for everyone. Care plans should always be patient-centered and adjusted as needed. In this scenario, you can document evaluations like this. Let's say that the goal is met, or other words, satisfactory. It can be written as, by the end of the first week, the patient maintained good balance while standing and demonstrated improved gait and mobility. However, if the goal is unmet or unsatisfactory,
It can be written as, by the end of 2 weeks, the patient continued to require full assistance with ADLs. If the goal is unmet, review whether it follows the SMART principles. If it does, the interventions may then need to be revised. This could include things like assessing underlying factors such as psychological concerns, environmental hazards, or any barriers affecting the patient's motivation or compliance. Another thing we could try for Mary is introducing range of motion exercise to reduce discomfort, increase joint and limb movement, and make mobility more efficient.
We have now reached the end of this video, and I hope it wasn't as complicated as it first sounded. If you have any questions, feel free to leave a comment below. Thank you so much for watching, and I hope to see you in the next video.